Hello everyone, myself Ida Sadaqat, and today's topic for discussion is chronic obstructive pulmonary disease, that is COPD. We are going to use a sample case study to discuss COPD and its management. So, first of all, I'd like to tell you about myself. I have a bachelor's degree in dentistry and a master's in public health, and I've been associated with MyAussieTutor since the past 1.5 years in academic writing. Okay, so first let's begin our discussion of COPD. We are going to discuss COPD by using a sample as a case study and look how it's supposed to be assessed and managed using nursing intervention. Okay, so first of all, what is COPD? COPD stands for chronic obstructive pulmonary disease, which is a category of debilitating lung diseases. It is mostly associated with emphysema and bronchitis. Emphysema basically gradually eliminates the air sacs in the lungs, obstructing the external airflow, that is the alveoli in the lung. The surface area increases, the alveolar coverings, they are broken, and the alveoli are eliminated slowly and slowly. Bronchitis is characterized by inflammation and narrowing of the bronchial channels, allowing mucus to accumulate in the bronchi. It can occur due to chronic smoke exposure or suspended particulate matter exposure as well. So, a combination or of both emphysema and bronchitis is what is COPD, chronic obstructive pulmonary disease. Now we are going to discuss COPD's management by using a case study as a reference. So the case study here presented will be, this presentation will discuss a case of a 68-year-old man, Robert Snyder, admitted for community-acquired right middle lobe pneumonia, has a history of working in a coal mine all his adult life and is currently retired, has a history of chronic obstructive pulmonary disease, hypertension and a current smoker of 20 cigarettes in a day. On assessment, he showed an SpO2 of 88%, which is low, along with a respiratory rate of 33 breaths per minute, which is high, and a heart rate of 102 beats per minute, which is also extremely high. His chest X-ray revealed consolidation in the right middle lobe of the lung. Also, he has shortness of breath on exertion, even standing up from the bed. He presents with restlessness, anxiety, fatigue, and illness. He is fearful and is restless and leaning forward. He has been advised oxygen therapy to improve SpO2 to 94% and IV antibiotics as well. The nursing management, intervention, and assessment and care plan developed for Mr. Snyder will be discussed in today's presentation. So we start with the assessment and the management. Nursing assessment for nursing aim of promotion and facilitation of adequate oxygenation. The assessment will include examining and recording the pace and tone of the breathing and breath sound, that is the tachypnea, the stridor, the crackles, and the wheezes for Mr. Snyder, and taking note of the inspiratory to the expiratory ratio. And then again taking note of any reports of air thirst felt by the patient or restlessness, nausea, respiratory depression, or the use of accessory muscles, as well as the occurrence and severity of dyspnea. Rate breathing difficulties. A 0 to 10 scale of the American Thoracic Society's grade of breathlessness scale will be used to make note. Moving on, for the promotion and facilitation of adequate oxygenation, what is the nursing intervention that we will give? It will first of all include improving functional and respiratory capacity. That would become a critical nursing intervention when a patient's ability to walk is impaired. Encouraging able-bodied patients such as Mr. Snyder to walk 3 times a day to improve breathing and aerobic fitness. The orthopnea posture or the tripod posture can provide relaxation from shortness of breath and improve ventilation in patients with chronic airflow restrictions such as Mr. Snyder. The tripod pose requires the patient to sit at the side of the bed with the board next to him or her, enabling the elbows to rest on the table which the lower body is compressed. To optimize lung expansion, what can be done is promotion of breathing exercises and incentive spirometry every 1 to 2 hours, boosting venous drainage by encouraging early ambulation and leg exercises, maintain airway patency by coughing to remove secretion and suctioning if appropriate, leading up to ambulation, delivering pain relief. Then the next assessment, that intervention that can help in promotion and facilitation of adequate oxygenation, is pursed lip breathing. Since it delays the collapse of the narrow airways by sustaining a higher bronchial pressure and prolonging the expiration, the pursed lip breathing strategy is particularly beneficial in patients with chronic airway restriction diseases such as Mr. Snyder. So basically, pursed lip breathing will be taught to the patient as a nursing intervention and will help in delaying the collapse of the narrow airways by sustaining a higher bronchial pressure and prolonging the expiration. Therefore, it is a strategy that is particularly beneficial in patients who are having restriction or airway restriction, such as Mr. Snyder having COPD. So for the same, the next aim for a nursing intervention would be the achievement of provision of general nursing care. It would include assessment of the level of physical exercise resistance, creating a calm and peaceful atmosphere for Mr. Snyder. During the acute process, limit the patient's movement and facilitate bed or chair rest. promoting self-hygiene for the patient in terms of self-care and ability to manage his own condition with the help of exercises, movement, adequate nutrition, and hydration. Pain management, administering oral or inhaled corticosteroids as indicated by the physician to reduce the pain and promote effective breathing and reduction in dyspnea for the patient. Then moving on, the next nursing intervention is the prevention of possible hospital-acquired complications. So when a COPD patient is having acute or severe pneumonia infection or a lung infection is admitted to the hospital, as in the case of Mr. Snyder, there is a need to prevent any possible hospital-acquired complications in the patient as well, or any cross-contamination. So the methodology or the intervention that the nurse can apply to prevent the same include infection or cross-contamination control by illustrating and helping the patient with tissue and sputum removal. Hand washing should be emphasized for both, and gloves should be worn while treating or disposing of tissues or symptom containers. Then advising flushing mouth with water and coughing rather than swallowing inhaled corticosteroids or using a spacer on the mouthpiece. It will help in reducing the drug's localized immunomodulatory impact and oral candidiasis danger as well. The potential infective risk due to oxygen therapy must also be avoided, that is, by frequently checking and sterilizing the oxygen delivery system. Bacterial exposure is a risk involved with some nebulization and humidification devices, hence they must be avoided. Okay, next, promotion of adequate hydration and nutrition for COPD patients is essentially important. In Mr. Snyder's case, there is a need for weight reduction and dietary counseling to promote healthy eating and some other forms of physical activity, such as walking slowly to promote weight loss without any exertion. Hydration, adequate fluid intake, and increased levels of hydration must be promoted and advised for Mr. Snyder to prevent dehydration and drying out of the respiratory and air cavity. Fluids help people with chronically elevated sputum development reduce the viscosity of the secretions at least. So that will help. Promotion of adequate hydration and nutrition is going to effectively eventually help the patient. So promotion of emotional and psychological support as well, as the patient is anxious, fearful, and tense. Patients with COPD benefit from psychiatric therapy such as community cognitive behavioral therapy, which improves psychosocial coping and reduces the anxiety and depression in COPD patients. For COPD patients, pulmonary therapy, which includes psychosocial assistance, reduces symptoms and promotes exercise resistance. To overcome smoking prevention challenges, psychological strategies can be used in conjunction with pharmacological method. Specific cognitive behavioral therapeutic treatments for people with COPD, as well as the inclusion of clinicians into COPD teams to have both individualized psychology feedback and a multidisciplinary team, and lead to program redesign, consultation, monitoring, and instruction also with some clinical and psychological strategies. So that is it for the day. These are the nursing intervention that we discussed and the COPD this thing. So the last nursing intervention that we can discuss or focus on is education and discharge planning, which includes avoiding specific smoking cessation and dietary improvement habits and advising the patient on the same, educating Mr. Snyder on the ill effects of smoking and the deterioration of his condition, promoting healthy behavior by reducing the adverse effects of COPD and further exacerbation and worsening, promoting the use of community education services and support services and respiratory hygiene as well, in order to promote cessation of cigarette smoking in the patient. So that's it. I hope you've understood the case effectively. So the case discussed here mentions the case of Mr. Snyder and the management of COPD complications that he is suffering from. Required nursing assessment and care to be provided. As a nursing profession, it is imperative to provide adequate patient education and health promotion relevant to COPD patients to help them manage their condition and prevent deterioration. Effective psychological, social, and emotional support goes a long way in doing that for patients already suffering from from COPD, as in the case of Mr. Snyder described here. It helps in better coping and situation handling. So I hope you have understood the topic of COPD for the day and how it is supposed to be managed using this case study of Mr. Snyder as a sample, and what are the assessments and managements and evaluation plans that need to be put in place in order to provide nursing care to a patient suffering from COPD admitted to the hospital emergency. Thank you so much.